Today I'll be talking about why the United States should have universal health care. The United States is embalmed in the idea that privatized health insurance is good and that the government is bad. But really, there are many people who are uninsured, and even the insured can't afford the extremely high cost of healthcare. So imagine you're a newly graduate college student, and you've been cautious about avoiding vehicles and engaging in any activity dangerous. But one day, while talking and walking with your friends simultaneously, you accidentally trip over one of Berkeley's many uneven sidewalks, and suddenly you have broken wrist and $2,500 in medical bills. But how are you going to pay for this? What if there was a way to pay for this treatment at little to no cost at all? The United States is, without a doubt, one of the wealthiest nations in the world, and with budget reallocation and taxes, can fund universal health care. Much of our budget goes towards military and foreign affairs, and while this is important, an economy and military can only function if there are healthy people. The United Kingdom, for example, has the most socialized form of medicine, and according to the NIH, the NHS, National Health Service in the United Kingdom, was founded under the principles of universality, free at the point of delivery, equity, and paid for by central funding. And today, the NHS has continued to uphold its founding principle. According to the Office for National Statistics, the NHS had a budget of $114 billion from 2018 to 2019, nearly all of which is funded by the government through taxes. And during this time frame, the $114 billion accounted for 9.6% of GDP, but in the US, during the same time frame, we spent $3.6 trillion, or 17.7% of GDP. Patients in the UK also pay virtually no out-of-pocket fees, whereas the US, you can pay hundreds or even thousands of dollars for the same treatment. So if you break your wrist in the US, you don't have insurance, you could be billed $2,500 or more. But in the UK, you would pay nothing. Many healthcare providers will also say that healthcare is right and even leads to healthier populations. It can lead to longer life expectancies and decreased infant mortality. As you can see by the graph by the Kaiser Family Foundation, the United States has a higher maternal mortality rate compared to other countries. And also, people enrolled in government programs which promote exercise and healthy living are less likely to be sick. So, the opposing side may say that giving the government more power is harmful to the people who want to take control of their own lives, and that healthcare is a commodity. So the United States is a country in which individual spirit and hard work reign, and freedom to choose is highly valued. But the Declaration of Independence says that people have the right to life, liberty, and happiness. Even the way of life was different in 1776 compared to today. Our founding fathers understood that life is precious, and anyone can easily be uninsured, whether it be they lost a job, they're disabled, or they don't qualify for any government programs. The NIH estimates that 45 million people were uninsured in 2005, 49.1 million in 2010. And during 1 week during the pandemic, 6.9 million people filed for unemployment, and in April, the unemployment rate was a staggering 14.7%, according to the Bureau of Statistics and Labor. The opposing side may also say that no private insurance means longer wait times to see doctors, schedule surgeries, and obtain organ transplants. But reality, with a universal system, quality of care is standardized, and efficiency is improved because a lot of administrative duties and costs are eliminated. Countries such as Taiwan, Singapore, Germany, and Britain have been doing great and have excellent healthcare systems, then they're able to bring down costs while maintaining quality of care and efficiency. In Taiwan, for example, you can even walk into a doctor's office without an appointment and be out within a couple of hours and not have to pay extraordinary fees. But however, in the US, medical fees can bankrupt a person, and people are often brought to financial ruin. In an article by The Guardian, Suzanne LeClaire Florida was diagnosed with cancer about 13 years ago, and after surgery, paid $300 in copay, filed for bankruptcy, and as of 2019, owed $52,000 despite paying for it throughout that entire time. In that same article, there was a study by the American Public Health Association which found that 530,000 people file for medical bankruptcies each year in the US. This is in the US. In this day and age of coronavirus, which does not discriminate against anyone, each day a person spends in the hospital, they're accruing more and more debt, and they have little control over how much time and money they spend. By depriving people of healthcare, the United States is essentially depriving its people of life. The Declaration of Independence says that people have the unalienable right to life, liberty, and justice in pursuit of happiness. But a prosperous nation is one in which the people are happy, healthy, and actively contributing to the economy. Thank you.